Today, I am going to explain on how to taper down thyroid related medications. Number one, after following my diets and health supplements, after 30 days, they have to cut down 50% of the dosage, whatever the doctors have been prescribed. Thereafter, after 30 days of that 50% medications, one has to get checked the blood parameters. Then they will see 99% thyroid related hormones will be normal. Then if so, further they have to reduce 50%. For example, if they are taking 100 mg, they have to reduce say 50 mg the first month. Thereafter, if it is a thyroid hormones are normal, further 50 to 25, again 25 to 12.5, like that they have to come out from the medications. Like that, your inbuilt system will start working, for which the most important is meditation, pranayama and diet, what I have defined. One should follow it. Thank you.